Next to last.
Oh, yes, I misspoke. I was premature on our next to the last budget day. So why don't we start off with Chris? Do you have remarks before?
Yep, no, that's right. Our first up is Human Services, and so we'll just kick it off.
Morning.
So we have Tony Merrill presenting from the Office of Management and Budget, and we have Karen over here going to do the same thing that we do with all of the BCC departments. So Tony, the floor is yours.
Good morning, Commissioners. Can you hear me okay?
Yes.
I'm Tony Merrill, and I'm here to introduce you to the fiscal year 24 budget for Human Services. Human Services is looking at a 0.4% increase for their fiscal year 24 budget. This is equivalent to approximately $237,000. On page 2 of your documents, we'll now look at some of the budgetary drivers. And our first bullet includes the budget of a 3% salary adjustment. This adjustment is based on the midpoint for all county employees, along with increases in career ladders for the Human Services Department and a future leave payout. This leave payout is for the Director of Business Services, who will be retiring in 2024 after 30 years of service. Personnel services are increasing by $288,570, or 2.8% total. Human Services has experienced lower than average enrollment in the Pinellas County Health Program, Healthcare for the Homeless. In the fiscal year 23, they reduced that budget by $1.5 million. This reduction will remain in place for fiscal year 24, but the department does expect an increase in enrollments as the Medicaid continuous enrollment is sunsetting. More clients will be eligible and start enrolling in the program as their Medicaid benefits are ending. The next bullet we're going to talk to is that Human Services is requesting an increase of 3 FTE employee positions. This is going to be for the opioid settlement funds, which the department is now in the process of developing. These positions are not funded by the general fund, so they are rather funded by the settlement allowance of 5% for administrative costs. Next bullet, the department has had some issues and concerns with turnover of their veteran service officers. They are working with Workforce Relations regarding market-based increases. In fiscal 23, they did do an increase of a 2% across the board for their officers. In fiscal 24, we've added $46,000 to the budget, and that we are hoping will address future retention and the recruitment for the veteran service officers. Our next bullet includes $6,600 in the budget for wireless internet and phone service. This is for 10 additional Guardian ad litem positions, and this is a required Article 5. So this is a mandated, we have to have this for this ad litems. Human Services is also responsible for the oversight of the Drug Abuse Trust Fund, which provides financial assistance in grants for local drug abuse treatment programs. The trust fund has reserves for fiscal year 24 in the amount of $15,540, an increase of $4,750, or 42% from fiscal 23. The trust fund revenues are increasing by $5,550, or 19.6%, to $33,900. And expenditures are remaining flat at $35,000 for fiscal 24. On page 3, we're going to go ahead and look at our decision packages that have been submitted. The department has submitted a request for 2 decision packages in fiscal year 24. The first decision package is a request for an additional $155,100 or 10% in funding for the social action funding. This request is based on the continued increased need within the community. Each year, the county receives over 50 applications from local nonprofits for requests of over $5 million. The approval of this decision package will expand funding in 4 priority areas, and those 4 priorities are listed within your documents. Our second decision package is a request for the continued utilization of one staff resource from Personal Services Plus. This position is fully funded by Health Resources and Service Administration federal grant funding and will have no impact on the general fund. Human Services is proposing an increase to 4 user fees for fiscal year '24. You'll see a table on page 3, along with the user fee schedule, which is on your attachments on page 15 of your packets. And with that, I'm going to go ahead and I'm going to turn the meeting over to Karen, who's going to talk about the Human Services accomplishments in fiscal year '23, the Human Service Work Plan and performance measures. Her team has also put together a short video that she'll be showing at the end of her presentation. Karen?
Good morning, Commissioners. Karen Yatchum, Human Services Department Director. And with me today, I have Clark Scott. So Clark is our 30-year employee who is our Director of Business Services. So he serves as our CFO of the department. He is retiring this year, so this will be his last budget meeting. I was joking with him about he could do the entire presentation as his send-off, but he's here in case you have any real tough questions. But I just want to publicly thank Clark. He has been such a wealth of knowledge for me as a newer director. He has always helped with the historical perspective, information on the health program. I would consider him an expert in LIP and Medicaid, and he really is the go-to, so he is surely going to be missed, and I just appreciate his dedication to public service.
So Karen, with that said, are you training or have you trained someone to walk into your place?
Yes, so we have been doing internal succession planning, and so Carrie Vizendu, if you want to just raise your hand, Carrie has been working with Clark for many years, and our goal is to move Carrie into that position and then recruit for her replacement. And so Carrie will be moving into the Business Services Department Director, and they have a really unique team because their team supports both human services and community housing and community development. So we're keeping that knowledge, and we're really happy with the move for Carrie and for Clark.
Good.
So as Tony mentioned, I'm going to walk through our work plan, our performance measures, and then our accomplishments. I'm going to end with the accomplishments so that we can show the video that I really think kind of brings a part of our accomplishments to life. Those are really well done. So for the Human Services Work Plan, we remain committed to several high-profile work plan items that really are kind of multi-year, so they're not kind of a one and done. They carry over from year to year based on the high community impact that we're seeing on some of those projects. The first was our optimal data set. So as you recall, the optimal data set was the 29 key performance measures that we developed with KPMG that we were going to roll out across all of our behavioral health programs, and then also our other funders were going to roll that into their contracts as well. So that's the Juvenile Welfare Board, Central Florida Behavioral Health Network, the Sheriff's Office, and the Department of Health. And so we are currently in phase 2. So we have developed those measures, we've obtained agreement on those measures, and now we are rolling those out into all of our contracts internally and working with those providers, going line by line by line, making sure that what their staff are inputting into their electronic medical records coincides with the data ingestion that we are pulling. So we are working with 3 providers currently receiving data, it's very labor intensive. Our next step will be working with an expert who will look at the process and make sure statistically no one can break what we're doing because we're working with de-identified data. Once that process takes place, then our partners, Juvenile Welfare Board, Central Florida, the Sheriff, and the Department of Health, have agreed to impart that into their contracts, where we will then be receiving all of the same performance measures, and we will be able to dashboard those measures to the public, to this board, and those again are the access, quality, and capacity measures for our behavioral health providers. Our next work plan item is our Bayside construction. So as I had indicated in a memo earlier to you this month, we are finally ready to break ground. This is a 2,400 square foot expansion of the Bayside Health Clinic. This is going to add 4 negative pressure isolation rooms so that we are equipped in the event of any kind of communicable or contagious diseases moving forward. It's going to add dedicated behavioral health space so that we can have integrated care right in the clinic. We're also expanding the waiting room so that we have more room for the staff, for the clients that come in for the services. We are modernizing the area for the staff to work. So right now we're very, very tight at Bayside Clinic, and this really is going to assist with the staffing, with the clinical operations, and then we're also adding an additional dental chair. So we provide a lot of dental services, and adding a 3rd chair to the Bayside Clinic is really going to be great for that population. We are moving all clinic services to the Largo Mid-County Health Department, which is really kind of right around the corner from Bayside. We are going to be closing for 1 day and reopening on July 11th, and all services will be transitioned to that location until we are able to reopen Bayside Clinic within the next year. And I should note that all of that construction, the majority of the construction was funded under HRSA. So a grant came through, we met with our team, we met with our community partners and our Healthcare for the Homeless co-applicant board, and the decision was really to proceed with expanding that clinic for much needed space. The third item I'd like to talk to you about today is that with the use of the county ARPA funding, we worked with BTS to really take a look at our internal systems. And so with the assistance of ARPA funding, we are revamping all of our systems within Human Services. This includes our electronic application for residents who apply for our health program, our internal case management program, our electronic medical record, as well as grants and contracts management software. We manage over 240 contracts in Human Services and over $26 million in grants. And so it's really, really important that we are keeping up with technology and that we're able to maximize efficiencies and operations and really take a more critical look at the way that we are doing business. And so that really has been the charge over this last year with the ARPA funding, is challenging us to think modern and to not continue to do things the way that we've always done them with our systems. We are requiring that any system that is purchased integrates with each other so that we're not creating siloed systems within the department. This RFP is currently live, so we are on track with our ARPA schedule, and it's closing at the end of July for rank and review process. So now I'm going to talk about our performance measures. As you can see in the document, we have several kind of community health measures as well as some internal measures. Human Services, because of the number of programs we have, we really thought it was important several years ago to really focus on those community indicators that show the health of the investments in what we are doing and how it impacts the community as a whole. We continue to monitor opioid deaths, overdose deaths, and then deaths related to suicide. And I did want to point out, we have built a robust dashboard, and I know that I talked a little bit about that at the substance use meeting, but we are automating those processes. So we get an automated feed from the medical examiner's office that pushes into our dashboard. So it's not a manual report. It goes every single day, and it's updated live, which is very, very cool. What we did find is there was a little bit of an error. And so in the medical examiner's reporting, or Rita's reporting, she had listed 615 deaths for 2022. And our report kept showing 596. And so this week we went line by line by line with the medical examiner's office to find those errors, and 2022 is going to end at 597. And so we were able to kind of take a critical look at that process and work with Bill and Rita on their team to figure out where the error was so that we can ensure that we have accurate reporting. 597 is still too many, so I'm not going to say that that's a win that we went from 615 deaths to 597, but I do think it's really important that we have accurate reporting that we are communicating to the public. As we've mentioned before, 597 is too many, and we continue to move in the wrong direction. But I will say that we remain hopeful with the infusion of the opioid settlement dollars. As a reminder, we have around $14 million this year to tackle the opioid epidemic. I remain hopeful that many of those abatement strategies will be able to really see some movement in that area. In regards to our homeless measure, so we track recidivism. So when individuals or families are rapidly rehoused, we track their returns to the homeless system. And so the continuum of care sets the benchmark, and that target is currently 30%. So they want to see less than 30% of individuals who have been rapidly rehoused, no more than 30% have returned to that system. And as a system, we're operating right around 15%. So I would say that the intervention is working. What I think is really important is the county, so Human Services through this board, we are the largest funder of rapid rehousing programs. So there are two main programs in our community, the Family Housing Assistance Program, which is our internal program, so our staff are doing that case management and that work, and then the Rapid Rehousing Collaborative, which is a joint funding venture with the county and the city of St. Petersburg. Those are the two large programs in our community. So that 15%, which I think is great that we're at half of what the expectation is really because of the investments that this county and this board allows us to infuse into the community. I will say, so some of our internal measures, as you can see, we really wanted to showcase what our Veteran Services Department brings to the community. And this past year, we were able to add 3 additional measures. So historically, we have always shown how many claims we've submitted, but what's the impact? So are they successful? Are they approved? Is it making a difference to the veterans that we serve? And so through, again, various reporting and our new quality and planning team, we were able to show that we're right around 72% success rate, and that we submitted over 1,000 claims last year, and that brought in over $7 million of benefits for our veterans. And to me, that is something to really be proud about. That is a small team. So that is a team of 6 individuals and 2 support staff, and that team made it so successful that $7 million of benefits impacted those veterans. And I'll just share personally, my father is a veteran, and those benefits are life-changing to them. So I believe that that $7 million is life-changing for many of the veterans that receive that service. We have been able to bring in a new director, so Reggie Fujimoto, I believe I also sent a memo. We brought in a subject matter expert. He has 23 years experience. He was a bureau chief with the Florida Department of Veteran Affairs. And already, he started June 5th, already in this first month, he is bringing me many ideas on things that we can do to improve our process. And so I'm very excited about his ideas, his efficiencies, the operational efficiencies he's bringing in, as well as the strength in him rebuilding this team. So he's currently very busy doing interviews, and it's really nice to have that subject matter expertise choosing those individuals who are going to serve our veterans in Pinellas County. So now I'm going to move into our accomplishments, and I will say I was told to choose 5, which is very challenging, so I did my best to kind of pick the top 5 that we could talk about today. And so much of this could not be accomplished without the staff in Human Services, their vision, their commitment, as well as the many collaborations that we have with our community partners. Additionally, I will say we also collaborate with other departments. So I have very great working relationships with our team. Jim Fogarty with Safety and Emergency Services, Kathy Perkins, and Barbara Hernandez with her team. You'll see in the video that's put together at the end, we have outstanding partnerships, and we challenge each other to continue to move forward and do better. So for consumer protection, this past year, consumer protection really tried to get in a proactive stance. You know, what can they do to help our residents proactively with the housing situation? As you recall, they were very heavily involved with the Tenant Bill of Rights. And what we continued to see were these online rental scams. So there would be postings on Craigslist and Facebook for housing opportunities that really seemed too good to be true. And our residents were falling victim to these scams. So they were doing multiple applications, paying multiple application fees, sometimes paying first, last, security, only to find out that house was never available for rent. And it's very, very hard to recoup that information in the finances. In addition, every time they do an application, they're putting all of their personal information on an application, which makes them fall victim to identity theft. And so what Doug Templeton and his team started doing is going on all of these sites and looking to see, are these fraudulent, then going on realtor sites to see if that house really is for sale. And if they were finding out that it was fraudulent, they would contact the online platform, they would have it removed, they would contact the owner or the realtor to let them know that there was a potential scam, and then also working with victims and reporting these instances to the FBI, because there's an internet crime part of the FBI. So they're really doing this proactively. And this past year, they've been able to take down 250 ads in Pinellas County, which really is protecting our residents. So next I want to talk about the syringe exchange. So as you're aware, this ordinance was passed in 2021, and a significant amount of work has taken place to bring the IDEA exchange to life. And the IDEA exchange is the Infectious Disease Elimination Act. So PERC, People Empowering and Restoring Communities, was the vendor that proposed their idea for the syringe exchange. And they worked for the past year on securing a location in St. Petersburg, and this opened in February of this year. And what I can tell you from February 22nd to last week, some of the accomplishments that they have had, they have collected 6,707 syringes. They have provided 5,860 new syringes. They have provided 776 naloxone kits. They have worked with the Pinellas County Urban League and the Department of Health and one of our programs through the Healthcare for the Homeless to also provide vaccines to individuals who are coming into that location. So they were able to provide 139 vaccines. 100% of the participants received on-site counseling. 100% of participants received wound care prevention information. And recently, this was kind of a recent success, they had 2 warm handoffs right into detox. And so I think that that's really, really important, and that's kind of one of the intent of this, is connecting individuals to treatment when they're ready. And so they were able to do that warm handoff right from their location. We have continued to expand our substance use initiative. So I know I've talked about that earlier this year. We have developed the quick response teams with both EMS and law enforcement. We successfully launched our Pinellas Matters pilot at Bayfront Hospital. We have conducted overdose fatality reviews and shared that information during a community information session. We've established the Opioid Abatement Funding Advisory Board, and we've also established the priorities, and those programs will be going live for procurement August 1st. This past year, we also kicked off the coordinated access model. So this was the year that we had selected the vendor, and we've been working on implementation for these past 8 months. Again, that's the Care About Me coordinated access model. And I will say we are very, very close. So we meet several times per week to make sure that this system is going to be ready for our residents. And we're down to 3 kind of red items that we're working through until we believe that we're ready to work with the mental health unit, with the sheriff's office, and then the public defender. And I think both of those partners will give us the raw, real feedback that we need. I know Lourdes kind of challenged the sheriff and said, break it, break it and then tell us what we need to fix. And so our goal will be, once those kind of 3 critical items are fixed, we'll be able to start the testing phase with the mental health unit and then launch to the public. Our emergency management partnership, so I'm happy to report we are in the final stages of contracting with shelter support and behavioral health support for our residents who need to evacuate into the shelter. We were very, very lucky to initiate this process last year with Ian, and I'll thank Barry for saying yes. I brought this idea to him and he said, yes, do it, absolutely. And we were the first in the state to do this, and it's really now considered a best practice, so many, many other counties are following suit. So we have vendors that will be bringing to the July meeting to you, where they will be bringing shelter staff as well as, again, behavioral health staff who will go into the shelters if we need them based on our evacuation numbers to help support our residents and to support that long-term care while we rebuild our community if we're impacted with a storm. And lastly, I want to share street medicine. And so I know I've talked about this for a while, and this was kind of something that we started thinking about in 2019. So street medicine is really a best practice. Many other states, and there's an international program for this, they deliver care on the streets to those who are unsheltered, and they're really called rough sleepers. So that's what the kind of industry names the individuals who are not attached to a shelter, they're not attached to a housing program, and they are living in places unfit for human habitation. We've been very blessed, so we have had the large mobile medical unit that goes to many of our various shelters. We had Bayside Clinic open in 2016, and this was kind of that missing piece. So how are we reaching those who are not coming into shelter, who are not coming into the Bayside Health Clinic? How do we bring medical care to them? And so we applied for this with a HRSA funding grant, and we were able to build this beautiful van. I will say this does not look like kind of a government van. Barbara's team, I think, did a wonderful job kind of titling this Driving a Healthier Community. This team goes around Pinellas County and finds individuals and provides them on-site medical care, access to behavioral health care, and then enrolls them in our program so that they can return to receiving care at the clinic or the mobile medical unit, and they also try to work them into securing safe shelter. And so this van has gone to the syringe exchange to assist with those who are unsheltered and who need wound care, who need medical care. They've gone to bus stops, they've gone to encampments, they've gone to every place in the community. And it's something I'm really proud of. And so we have, this past year, we have touched 1,600 individuals through this van, and I really think that they are out there saving lives. So I really want to thank Barbara and her team, not only for the design of the van, but when you see this video and you see the interview that they conducted with one of our clients, you're going to see that the impact that they made and how they really saved her life. So we're ready for the video. Street medicine is so important in our community because it brings clinical services to those who are unsheltered. And so for many years, we have operated the Bayside Health Clinic, as well as our large mobile medical van, where we bring services to a location and people come to us. And this one really is different. So we are going out in the community, we're going and finding people who are living unsheltered and meeting with them, building rapport, and offering clinical services to keep them healthy and keep them alive. We have great partnerships for the street medicine team. So we primarily work with the Department of Health. So they are the clinical team. So the nurse practitioner, the nurses, the family support workers, they are employees of the Department of Health, where they can provide all of the primary health care. And then we also have a partnership with Directions for Living, and they provide access to behavioral health care services. And then soon we will have telehealth on the van with Operation PAR so that we can link individuals who need substance use care to that provider as well.
Street medicine actually found me. They go around to different parks where the homeless people are, and you know, they like to make sure that everybody is offered any kind of medical assistance they need. And when they found me, I was in desperate need. They were very open and honest, and they cared. They cared that I was a person and not just a homeless person.
We are out in community, so you may see the van at a park, you may see the van at a bus stop, you may see the van, you know, behind a building where people are living, and it's really about that engagement. So it's engagement in medical care, and it's also engaging them and talking to them about their living situation and maybe helping them get into a safe shelter.
Without this, I would maybe dead. They kept at it, you know, they keep coming back, you know, they want you to get the help you need. Now I run to the van. So I just love them. Everybody needs a street team, you know?
Questions, comments? Commissioner Flowers?
Good morning. Thank you so much for that presentation, because you know this is one of my little field areas. Just a couple of questions. Well, first let me start with a comment, then a question. Some years ago, when Commissioner Welch was on this board, the Pinellas County Urban League was able to get a van that they retrofitted into a medical mobile unit. And it was out and about in the community. And then I think they did not get funding for the operating of that van, but they still have that van. So just a suggestion, if you guys ever, are looking to expand that service, I think it would be real good to consider reactivating that. That would just help maybe expand your reach in there. I fully support the 3 positions related to the opioid settlement. But I believe in the presentation, it was that those positions would be paid for out of the 5% admin costs. And so there's a plan in place to continue funding. I'm asking the question. Is there a plan in place to continue the funding for those 3 positions past the initial phase? And that would come based out of programmatic funds, general fund, or what? So I'm asking that question.
So both settlements are over 18 years. And so I will say my business services team, which they're better at Excel than I am, have done the math. And so the 5%, we end up, I'll say, in the negative in 2034 with the 5%. So we have about 10 years that we can utilize those positions, and then we may need to make another plan in 10 years. So that was the charge that Barry gave me when I talked to him about those positions.
That's the reason I turned on my mic is, when you're getting a new grant in, it's so easy to go outside of the grant. In other words, you could have 100 programs, or you could have 10 bigger programs of which we have to manage, track, report. And so the challenge to them is you got a new grant, you need to live within the grant and the administrative dollars. And so that was the challenge that we gave back to the team, and they're gonna have to work with the opioid task force in terms of some of those decisions to be able to where they can sustain this over time.
Thank you. And then for the presentation relative to the error that you all discovered between the ME's office and the actual reader board for you, can you share what the error was? And if that occurred, is there the propensity for that error to occur in other data being transferred from one component to your reader board?
Yeah, so I'm trying to remember the summary that I received. So I believe the difference, there were a few deaths that had carbon monoxide listed as the death, and they were merged into this data set, so they were pulled out. And then there were, I believe, a few that carried over from the year before, because there's a period of time where the death occurs and then the ME's team does the full investigation. And so a few of those individuals carried over to the other year. What we have done is now we have set a monthly cadence where we're going to review all of those on a go-forward basis so that we don't have the error moving forward. And then we did ask the medical examiner's team to ensure that they send out an updated spreadsheet to the opioid task force so that when it's sent out, it's accurate.
Great. And then my other question is, there was some change in legislation that affects individuals' ability to be eligible for Medicaid. And I see where in your reading that the numbers for the Medicaid healthcare services, service numbers are down. Just sharing or asking, have you seen perhaps since the report an increase in requests for Medicaid services since that just happened? So perhaps some people who are eligible or were eligible before are no longer eligible, so they may be looking to utilize this program for services.
Yes, so we, when we learned about this, we reached directly out to the Department of Children and Families to make sure that there was, we could work in alignment. So as individuals were coming off, that they could share information about our program as well as other programs, because again, we're the safety net provider, so we're kind of like that last resort for individuals who don't qualify for Medicaid, may not qualify for the marketplace, and they really, really need our services to keep them, to keep them healthy. So we started the tracking in our internal case management system so that anytime someone applies, we now ask, what did you just lose Medicaid, so that we can track on a go-forward basis for those that are coming off that continuous enrollment process and who are coming into ours. So we should have those data indicators based on the responses of, yes, I just lost Medicaid, and now I'm applying for the Pinellas County Health Program.
Okay. And then just a final kudos. I see your team member here, but I was over at Pinellas Technical College they have had several job fairs, and we typically are present, but it was just really nice to always see. It is always really nice to always see Pinellas County government present, being able to communicate with the public and informing them of what jobs we have available. As a matter of fact, there were 3 people that applied for the 911 jobs, and one called me about the test. I guess they get a test or something, electronic link or whatever. I know that's not your area, but just sharing that people are coming, they are visiting our booth, they are taking advantage of the opportunities we have available. So just wanted to give a shout out to your teammate and thank you for that.
Anyone else? Commissioner Eggers?
Yeah, first of all, thank you for the presentation and the work that your team does. It certainly personalizes government in terms of reaching out to our residents. We drive around all over this county and see folks that have a grocery basket and they're just kind of hanging out and wondering if we're making contact with them. So it's nice to hear that we're making a proactive effort to get around the county. And on that item, you have a sense of how we're doing in terms of that penetration into that group of folks that are out there, that at least trying to get them registered and get them. You have a feel for that at all? I mean,
So I'm not sure I understand as far as enrolling them into the health program.
Yeah, making contact first.
Yeah.
Trying to develop trust and then getting them enrolled.
So we're really trying to, we have to pull that data. So of those 1,600 touches, we're going to follow those through and determine how many of those we were able to enroll. I will say sometimes it takes a couple interactions for them to trust the team. I spoke with Martha that day and learned that the first interaction, she wanted nothing to do with the van. She wanted nothing to do with that team. And it took probably 3 or 4 interactions before she would. And then that day, she enrolled in our program. So I would say, we are making an impact, but as far as the numbers, I'm going to have that probably within the next few months.
Yeah, and the transient nature sometimes is difficult, I would
Very.
imagine. So,
Very.
so just appreciate that effort. And I was glad to hear on the syringe exchange that you're 100% of the folks coming in are at least going through the counseling piece. I mean, at the end of the day, you want to make sure that we minimize the disease issue, but we also want to try to get people on the right path. And
Right.
I know it's not easy, but that's an important first step. So appreciate that. And on the VA officers, how many empty spots do we have now?
We have 3.
How many vacancies?
3 vacancies.
3 vacancies. And feel like the adjustments will be good enough to get. I would
do.
imagine you're getting people from the VA actually probably taking.
No, not so much from the VA. The VA actually is stealing our people. So
That's what I mean.
Oh, okay. Yes.
Yeah.
So
Yes.
we're kind of the ideal training ground. So we're hiring individuals, and then the VA is taking them. So we're trying to look at how do we compete, both with salary benefits, remote work schedules. So we're really taking all of that into consideration. But Reggie has been actively interviewing. That's really the first charge he has made, is to build his team. And I would say for each of the positions, we have over 35 applicants. And they're all veterans, because that's the requirement of the position.
Which I think is a nice touch, and the impact that you're making, even with the small team that you have, is pretty impressive. So anyway, keep up the great work. I think you guys, and congratulations on your retirement and the next phase of your life.
Commissioner Peters?
I just want to thank you for all your hard work. Your report is exhausting. You've got to be exhausted, but you do an outstanding job. And I'm just really proud of your team and your department because you're doing really, really great work.
Thank you.
Thanks.
I have the best team, I will say. The best.
Commissioner Scott, do you have anything to add? Turn your mic on, please.
Congratulate you on your retirement, and Karen, just appreciate everything you do, and you do a tremendous amount of good in this community. So thank you.
Thanks.
I think it goes without saying, we all feel the same about your presentation, the work that you're doing, and congratulations to you, and thank you for your service to Pinellas County for 30 years. That's quite an achievement. You're welcome. Okay, is that it, Karen?
That's it.
That's all.
That's it.
Well, that was great. Thank you.
Thank you very much.
Yep, you're welcome. And now we have Dr. Cho from the Health Department. Good morning. We haven't seen you for a while.
Mike.
Well, good morning, everybody. Good morning, commissioners.
Good morning.
Good to see you.
Who's doing what?
So Dr. Cho presents his own budget. So
Okay.
we've got John Ondrovic here in case there are questions, but he's got it, and we're here for support. We're all here for you.
Thank you for that.
I think you said you're on your own.
I guess. Okay, well, good morning. And I do want to start off by thanking the County Commission for the ongoing support of public health and sort of our mission here in Pinellas County. I'm really proud of all the partnerships, including Human Services. We work very closely with the county, as well as our public health staff, our dedicated public health staff. Now, our mission at the Florida Department of Health is to protect the community, to promote good health and good choices, and to improve the health of all Floridians through integrated efforts. Our top health priorities, and I get this question from time to time, and I refer to the Community Health Improvement Plan, as it's not necessarily the priorities identified by the Department of Health, but from the community partners looking at the data and prioritizing. Those top health priorities include access to healthcare and social services, behavioral health, and mental health and substance abuse. One of the numbers I'm most proud of is our number of services. We provide 1.2 to 1.3 million services annually from a diverse array of service lines, including things like primary care, communicable disease, environmental health, school health services, health promotions, preparedness, among so much others. Now in your document, you do have a list of accomplishments over the past few years. I'd like to highlight a few here today, starting with dental sealants. Dental sealants, as you know, prevents cavities and really goes to the heart of what we do in public health, which is prevention. That primary prevention, preventing things from occurring in the first place. Now, we offered this service to Title I elementary schools since 2014. It's a simple preventative procedure that helps kids' permanent teeth from decay. In this past school year, we're able to reach out to 42 out of the 48 Title I elementary schools. Our goal will remain to hit all of the Title I elementary schools. I believe there was some space issues. In terms of the numbers, we screened over 6,300 kids and provided over 12,000 sealants. We also participate with Head Start on some of the screenings, and we conducted 884 screenings. Now moving on to school health nurses, some of the benefits, and I think most of this group knows the benefits of having a school health nurse, is that it increases referrals to community services and agencies, including things like mental health referrals as well as social services. It increases educational opportunities for families and students, and assists with those mandated physical screenings, things like vision, hearing, scoliosis screenings, and most importantly, it assists and improves the return to class rate. This past school year, we've made 26,637 referrals altogether to both, again, mental health services as well as social services. Our return to class rate was 87%, and we did exceed the targets for the mandatory screenings of vision and hearing. To provide a little bit of update on some of the challenges, about the school year 21-22, we did have a nurse in every school, but as you may be also aware is that there is a nursing workforce shortage, and this is a national problem seen in hospitals, in clinics, health departments, as well as school districts. Our goal remains to have that nurse in every school, and what we're contributing with this allotment is 40 LPNs to reaching that goal. And one other advantage I'd like to highlight of having that school health nurse and as well as that partnership is that they were able to help out with response efforts, specifically in the special needs shelters. The Department of Health is responsible for staffing those special needs shelters in times of activation, whether it's any disasters, hurricanes. These are taking care of our most vulnerable populations, those that are electrically as well as oxygen dependent. And these LPNs and these school health nurses did assist in those efforts, especially, and they were a tremendous help with Hurricane Ian last year. And then lastly, just highlighting the opioid overdose prevention. I think Karen spoke in detail about this. Obviously, it is a top health priority, just given some of the numbers, given some of our trends. In 21, one Pinellas County resident died of an overdose every 14 hours, so that's sort of a startling sort of number. And again, that's one of the reasons why it is a top health priority, and the 22 numbers are unfortunately increasing as well. There's unfortunately more and more synthetic opioids on the street, the fentanyl analogs, the nitazines, as well as the non-opioid drugs, those tranquilizers out there like xylazine. But again, there's hope. We have a dedicated community group, community partners that are working very closely on this. It's been a collaborative effort, and at the health department, we look at the data and trends through our OD2A grant and through our opioid overdose prevention office. We help facilitate and lead the opiate task force and do participate in the opioid abatement. And I agree with Karen, I'm very optimistic, just given the opportunities with the settlement dollars that are coming through, that we may be able to fill in some of those gaps and needs within that system. At the health department, we've distributed over 1,300 naloxone kits since November of this past year in our clinics, as well as our outreaches, and conducted 39 overdose to action outreaches in 22. And then moving on to the budget and the financial piece, this current fiscal year, 22-23, our total funding was $6.8 million through various funding sources. Our core contract here with the county is at $7.9 million through a public health millage, largely utilized in our pillars as identified by the Florida Statute 154. That includes clinical health services, communicable disease and environmental health, the majority of which was used 47% for clinical health services and support, 20% for the school health initiative, among others. Now for the upcoming fiscal year, we have no fee schedule requests for this upcoming year. We are seeing some increase in fund balance, which we're allotting to capital projects such as building generators, fire alarm systems, and significant AC repairs, and as well as the future savings. One of our busiest in our headquarters is our St. Pete site. It is aging, so we are planning and initiated some talks on a multi-year plan to move to another building. So with that, is there anything? I'll stop there. I'll take any questions.
Questions, anyone? Anybody?
Just for commissioners may not know, the health department operates a little bit different with like the reserves. So they save up and then pay for their building repairs. So it's not part of our internal county capital funds. So they pay for their roof replacements and things like that. So that's what Dr. Cho is referring to.
Looks like we'd have no comments and no questions. Must be doing a great job, Doc.
I appreciate that. Okay.
Thank you. Office of Human Rights.
All right. You're on.
So through the chair, as Jeffrey comes to the table, we've got Belinda Amundson going to present on our side and turn it over to Jeffrey for his accomplishments and performance measures, just like all the other departments. So Belinda, the floor.
Morning, Jeffrey.
Yep.
Thank you, Chris, and thank you, Commissioners. Good morning, Jeffrey. Beginning with a quick summary of the Office of Human Rights budget on page 1, the FY24 expenditures are increasing by nearly $56,000. Moving on to page 2, the bulleted items, most of the department's budget expenses and increases are represented in personal services, which are increasing just over $50,000. This represents the 3% salary adjustment on the midpoint for all the employees, along with state increases in retirement contributions and a few merit increases. The remaining budget increase is due to anticipated growth in language interpretation services and legal services for fair housing hearings. EEOC reimbursements are expected to decrease just a little bit from what we had planned in FY23 by about $11,000, while the Fair Housing Assistance Program grants are remaining steady at $200,000. The department received a HUD grant earlier this year to replace their laptops and purchase some additional technology and equipment, and that eliminates those laptop replacement purchases over the next few years. And with that, I'll now pass the conversation over to Jeffrey, starting with accomplishments on the top of page 2. Jeffrey.
Good morning. Could you put your microphone on, please?
Right there? All right, great.
Thank you.
Thank you. First of all, the Office of Human Rights is committed to protecting all residents in Pinellas County from discrimination in areas of housing, employment, public accommodation, and wage theft recovery program. We are a staff of 10, 5 investigators, a wage theft administrator, and also an intake specialist and an admin and myself. We do approximately about 150 investigations a year of discrimination. Our office receives or leverage our HUD grants to do outreach in the communities, particularly underserved community, underrepresented communities, providing them discrimination information. And I appreciate Commissioner for the shout out for being at the outreach. Many of those outreaches take place on Saturday, but we still make it our business to be there to provide information to the community as it relates to fair housing. We were able to leverage our HUD grants to do an outreach for April at the Greenwood Rec Center with our property appraisals department. One of HUD's emphasis this year is property appraisals, so they were excited that we were able to do that collaboration. We also did 2 days of outreach through the Apartment Association about fair housing, and that happened in April during Fair Housing Month. We also continue to provide civil rights assurances for county departments that apply for federal funding and also other related materials to procure those funds. We also enforce the American Disabilities Act to assist the public in public accommodations and reasonable accommodation requests to access government services. We also staff the Advisory Council for Persons with Disabilities, who assist the county with technical assistance in terms of oversight on projects related to disability compliance. We also continue to provide anti-harassment training for all departments upon request. So far this year, we've done 36 in-person trainings for departments, and we have a video that we offer online for employees to view, and almost 700 employees have reviewed that online training. We continue to run a robust wage theft program. We've set 70 cases for hearing before the special magistrate, and we recovered over $36,000 back into the pockets of everyday working persons. And over the 7 years of administrating that program, we recovered over $600,000 back into the pockets of our citizens. The Office of Human Rights also leveraged additional funds to secure additional legal firms for our cause fair housing cases. We've had a record number of cause fair housing cases. Our contracted law firms are at capacity, so we're in the process trying to recruit new law firms to take these cases into court for litigation. We also continue to provide our Title VI obligation of LEP for limited English proficiency. We provide each department with a 3-digit code and an 800 number to have real-time translation services for over 200 languages. We also continue to educate our staff up on new guidance that comes down from the HUD and EEOC as it relates to civil rights enforcement. And that concludes my updates. Any questions?
Questions from anyone? Well, I have one. maybe I just missed it and you said it and I wasn't listening properly, but it's interesting that the total for 23 is $636,440 and then it goes down in 24.
The 600 and, for what particular line item?
It's in the general fund. Am I reading that right? It's on page 3.
Oh, okay, so. You see over on page 3.
That's the first time I've ever seen it go down.
You know what, the second piece, the Office of Human Rights?
Page 3.
Yeah, the fair housing went up.
It's just between the programs, right?
Yeah, that's just between the programs.
Yeah. Yeah. Yeah.
Okay.
Charging things off. You see how it went up from 685 to 835.
Madam
All right.
Chair,
Yeah.
so it is, if you go back to page 1, you'll see the overall is going up a bit from 1.279 to 1.377. That's the overall. Part of it is there's a little more federal money coming in that one program that you're looking at. So the general fund comes down as the federal goes up. But it's that one program. He's got 3, I'm not remembering right, 3 different programs that he's providing service in. That's how we're tracking it. So it's not that it's going down, it's other funding is filling in the gap there.
I knew there had to be an explanation. I was
ma'am.
just curious.
Just-
I
Yeah,
apologize.
Overall, it's going up just a
Yeah,
little.
there's special funding that we can apply for that HUD doesn't make available every year, and we were able to leverage those funds this year for additional expenses for taking our cases into court, for the purchasing of equipment and the purchasing of outreach. HUD will put that money in our budget, but it isn't there every year. It's not guaranteed.
Thank you.
Thank you for keeping us on our toes. Appreciate
Well,
it.
I don't know why that leapt off the page to me, but it did. Anyways. All right. Is that it?
That's it for me. If there's no more questions.
Any further questions or comments? Anybody? No? Well, okay. Thank you so much. That
Thank
was
you.
easy. Emergency management.
So while Director Perkins comes to the table with Betsy beside her, good partners as well, we have Tony Merrill coming back. She was here earlier for Human Services. She is also the budget analyst for emergency management. And I'm vamping and stalling for a moment. Well, there she is. Okay, good. So Tony will present first, and then over to Kathy after that.
Good morning, Kathy.
Good morning.
Good morning, Commissioners. Again, thank you for letting me present the 24 budget for emergency management to you today. Emergency management is looking at a 4.5 increase in their fiscal year 24 budget, which is equivalent to about $92,930. We're going to go right ahead and jump to page 1, where we're going to look at our budgetary drivers. This budget includes a 3% salary adjustment on the midpoint for all county employees, along with the reclassification of one position. The total personnel increase is $59,720, or 3.5%. As the committee is seeing and the commissioners are seeing in other departments, emergency management is also experiencing hardships with the retention and recruitment, and a classification study is currently underway. This budget also includes an increase of $33,710, or 10.2% in operating expenses. This increase includes some of the following. Contractual services is increasing $13,450, or 20.3%. due to the increasing cost of shelf-stable MREs and the annual service plan for the MiFis. The freight and postage are increasing 3,450%, which is equivalent to 23.2%, due to the increased need to contact the special needs groups for disaster preparedness. I'm sure that when Kathy will talk a little bit about that dilemma when we get to that point. Repairs and maintenance are increasing $1,750, or 38.9%, due to inflationary costs for supplies, electronic equipment. Some of those percentages, I do want to point out, they seem very, very high, but we have to remember that emergency management has a smaller budget, so even the slightest bit of an increase or decrease is going to have a larger percentage marking. On page 2, we'll go ahead and look at some of their decision packages. Emergency management submitted a request for 2 decision packages for fiscal year '24. The first decision package is to add 1 full-time employee as an office specialist 2. This will consolidate the administrative tasks into 1 function. A lot of the upper management is doing those tasks now. The department feels that they may better utilize the upper management positions by hiring an office specialist too. The second decision package is to add 1 full-time emergency management coordinator too, and this person will be responsible for recovery planning and the recovery task force development. Emergency management is not requesting any increases to their user fees. So with that, I'm going to turn it over to Kathy, who's going to talk to you about emergency management's 23 accomplishments, work plans, and performance measures. Kathy?
Thank you so much, Tony. Thank you, Commissioners. It's nice to see you again. 2 times in less than a week for emergency management is a lot, and it's been all good news. So even though we have a couple of things out there we're monitoring, nothing to worry about at this time. So I just want to thank you for your time, and I did have the privilege last week to share with you many of the accomplishments and much of the work that's being done across the county for hurricane preparedness and efforts that your emergency management department is leading. I just want to take you back. So we actually started out our fiscal year '22. I congratulated Barry on passing the new budget, and I told him hopefully we wouldn't bust it within the first week with Hurricane Ian. So we got very fortunate last year. But even though we didn't have severe impacts in our community, our office continued to work on damage assessment reporting with our residents, county, municipal partners, many of our businesses to help get financial support. We continued to work on getting the emergency declarations for categories C through G. We already had the protective measures and debris declarations before the storm hit, but getting categories C through G was not guaranteed because we didn't have the impacts. Through our work, we were able to get an additional $4 million countywide in FEMA disaster funding. That helps our communities recover after an event. For SBA loans, it's estimated that over $7 million were approved as of May for our community, and we worked very closely with economic development to reach out to many of our businesses that may have been impacted. We also worked very closely with our voluntary organizations active in disaster. These are many private nonprofits, faith-based organizations that come together to help us help the community. These are oftentimes the people that have the unmet needs, the people that fall through the cracks either because the federal assistance isn't enough to help them or our social service agencies are just overwhelmed. We have an active group of over 50 members who continue to meet and coordinate efforts, and this really sprouted out of our work through COVID. We also sent 6 of our staff members along with staff from Parks and Recreation, Human Services, and from the City of St. Pete to help support our sister EM programs and other counties that were hit much harder than us. And this is always a great learning experience for us when we get to go to other counties and learn from what they're going through as they're recovering. In the beginning of November, we had to switch gears as Hurricane Nicole threatened us, and we actually opened 2 community shelters and housed 66 residents. And you heard Karen talk about the efforts with the homeless. A lot of times it's our most vulnerable homeless populations that we bring in for these tropical storms into our shelters. In December, we held 7 after-action meetings for Hurricane Ian to discuss what went well and what could be improved upon, and compiled an overview through our after-action report. We presented that to you in February, and we just finalized our report in March. December also marks the ascent into what I call avalanche season. So we've got hurricane season and avalanche season here for emergency management. And this is really when we start the work for prepping up for the next hurricane season. It's when we start designing our new hurricane guide, incorporating feedback and items from the past hurricane season. And we begin all of our planning for the training, exercise, and outreach that needs to occur to help ensure that our agencies are ready. And as Tony mentioned, since COVID, we've had a turnover of 4 people in our staff, 4 out of 16. So a quarter of our staff has left in the last year. And every time we lose somebody, we lose that institutional knowledge, and that's not always easy to replace. So we always want to make sure that we're doing everything we can for our staff. Just to give you an idea, in fiscal year 20, we were activated for 226 days, and some of that included weekends. Fiscal year 21, 174 days, obviously both of those primarily for the pandemic. Last year seemed light. We were activated for 25 days, but for this year, we've already been activated for 40 days. And as you can imagine, it's just a complete disruption from all of the day-to-day work that we're trying to do, focusing then on the immediate event that is occurring. We've been very active in working on our personnel for their career paths and ladders. We have over half of our personnel who are actively working on path advancements. We've invested in training for our personnel, sending them to conferences so they can learn from our counterparts and subject matter experts from across the country. And we've supported training and credentialing opportunities to support the growth for our personnel. We leverage free training courses and opportunities from our federal and state partners. We really strive to be a leader in emergency management in the state. With every activation, we review what went well, and we maintain a master improvement plan that we started in 2019 after Hurricane Dorian. We had 439 items on that plan. We completed 278, and then with Hurricane Ian, we added another 167. So it's a lot of job security for us, but we are constantly looking at what can we do better, what happened in this event that might need some tweaking. And certainly one of the areas that we do want to do more on is our recovery planning. We will be hosting a disaster housing workshop in July, and we've been collecting information on how many of our communities to the south of us placed mobile homes and travel trailers, and we've been working with the hotels to try to get additional folks to sign up for the FEMA transitional shelter assistance. We continue to work on our robust work plan, and we're also working on non-hurricane items as well. We've been working on a family assistance center planning and working hand in hand with the sheriff's office with the active assailant exercises that they've been doing so we can have a cross-coordination across all county partners. And we've increased our efforts and partner relationships to reach out to isolated individuals. And as you heard Karen talk about earlier, the homeless are a real concern when we have storms. So making sure that we're partnering with our homeless providers, the homeless leadership, so we can do as much as we can to help those folks during their time of need. In the last fiscal year, we reached out to 332 folks in isolated communities. This year, we've done over 1,000, and we're still not done. We have our second annual Deaf Day preparedness event coming up. We continue working with our at-risk communities, and one of our successes right now is partnering with Dr. Dixon from USF to create a storm squad in South St. Pete neighborhoods. These are grassroots folks that are coming together to help disseminate preparedness information and also to make sure that residents have access to recovery resources. And we hope to use this model to take to other communities across our county to replicate. We're very actively involved with our faith-based organizations. We held a webinar that we co-hosted with the United Methodist Committee on Relief, the Salvation Army, and the New Faith Free Methodist Church. We continue to grow our partnership with schools and the Department of Health, as you heard Dr. Cho talk about as well. We've been working with schools on curriculum development. We created a video for all third graders to highlight the coordination between local, state, and federal government, and that was filmed in our EOC. And we're continuing to look at ways that we can integrate into schools. As you remember, 2 years ago, we launched our first hurricane guide. That was the Newspapers in Education collaborative. Again, getting newspapers out to every middle schooler so they could take it home to their families, so then hopefully they will be better prepared. Our partnership with Duke Energy has been amazing. This past year, they supported us with our bags for our hurricane kits of a $4,600 donation. The City of Largo and City of Pinellas Park have supported items for kits for donated items. And Emergency Management has brought in almost $15,000 worth of donations from community partners and individuals in the community. Our whole community group that you helped us increase by adding a person several years ago has actually brought in over $90,000 worth of donations since we added a second person to that group. Us being able to get out into the community and meet with people is just so critical. I like to say that our relationships and networking with people is really our secret superpower. As a small entity, we rely upon all of these relationships and agencies to help us. We've been very busy out in the community this year, presenting to the Mayor's Council, Big C, multiple chamber events, the Tourism Development Council, at the Resiliency Summit, presentations at the Governor's Hurricane Conference, NOAA Hurricane Summit, and I'll be doing a presentation for the Southeast Media Markets for Hurricane Conference in a couple of weeks. As Tony mentioned too, we worked very closely on our special needs program. Those numbers ballooned up to 5,200 during Hurricane Ian, and we wanted to make sure that we had the right people on the registry. So we did a massive call down, we did a big mail out, and we got about 800 returns just from the mail out. You know, unfortunately, this is a very vulnerable population, and as people pass away, we want to make sure we keep that current and accurate. So we spent a lot of time working on that this year. And I want to also thank you for your support in making a part-time position that we had into a full-time position this past fiscal year. Through that work, we've been able to increase our work with municipalities to increase the community emergency response teams. These are individuals in the community that are trained on light search and rescue, basic first aid, and how to interface with responders, help report what's happening in their communities. They do a lot of support for us during disasters. We are working on our search and rescue plan through this position, working on a peer support plan because we know that mental health is a big issue, not just for people in the community, but also for all of us working behind the scenes. And this now allows us to have a full-time emergency management person dedicated to interfacing with our emergency services branch when we activate. And this allows for continuity from our day-to-day operations into when we activate. And Commissioners, I just want to ensure you that we will continue to work on our robust work plan to engage and empower our whole community partners, address our at-risk communities, ensure operational readiness, and promote resilient communities. With that, I'll open it up for any questions.
Any questions for Kathy? Commissioner Scott.
Thank you, Madam Chair, and thank you very much for that detailed presentation. A question on the two decision packages. So the first one, is that saying that existing staff is just spread too thin?
So right now, we do not have a main administrative person that answers the phone. It's kind of whoever can get to it first, so it round robins through our entire staff. So it does interrupt. We do a lot of planning, a lot of meetings. A lot of times, many of us are out of the office, so it makes it difficult for us to be able to answer those phones quickly.
And on the second one, is that a result of the experience that the counties to the south of us had? I mean, so have we identified a deficiency in our planning or disaster response? Is that what's driving that one?
Yeah, and this is something that we've been wanting to do. I have a whole chart of all the plans that we want to create. We have a recovery implementation guide that we want to get to, the disaster housing plan, unmet needs plan, and just because we've been so busy over the last few years, we have just not been able to get to it. So, and this is critically important, especially as we saw down south. I want to be able to have as much of this stuff shelf ready, and I understand that for every event it's different and we'll have to calibrate it, but the more that we can have pre-planned, the relationships that we have, how we're going to be able to place disaster housing, I think that will really help us move along faster.
Great. Okay, thank you.
You're welcome. Renee, Commissioner Flowers, you have anything? No? Anybody else? Commissioner Eggers?
Well, thank you. You know, it's obviously in April and May, we start gearing up, I guess, for the season again. And listen to all the prognosticators talk about what it looks like. So I always wait to hear from Kathy, what she's kind of gathered from the, you know, meteorological community about where we are. I just heard something last week that said like the waters are 2 degrees cooler or warmer than they were before, and so it might be early, we have some things earlier than we normally would. So anyway, just maybe some comments on.
Yeah, and thank you for that, Commissioner. So a lot of people like to hang their hat on it's an El Nino year, which
Right.
you know tends to lessen the number of storms. I like to remind people that 1992 was an El Nino year. The first storm out of the gate was Andrew, late August, and that was a Category 5 storm that just changed Miami-Dade forever. So it really doesn't matter how many storms there are, and yes, the waters are a lot warmer now. We've got 2 systems out there now, and you know, when you read the meteorological reports, they were even surprised to see things popping up and even getting, you know, to the strength that they have already. So it really doesn't matter how many we have. We always have to be prepared. One storm can really not only ruin your week, but ruin your whole year. And we saw what happened down south with Hurricane Ian.
Thank you.
Excellent presentation. We already know from past experience how good you are and how well your department operates under an emergency. So thank you for doing what you do.
Thank you. It's the team. The team makes me look good.
I know you won't be shy if you need anything.
I'm never shy, right, Barry?
No, I can attest to that.
Thank you.
Thank you.
Okay. And now we have Animal Services.
And while Director Brightwell comes to the table, we have Belinda Amundsen back again to present the OMB side of things, and then she will turn it over to Doug right after that.
Good morning.
Thank you again, Chris, and good morning again, Commissioners. Beginning our discussion with a summary of Animal Services budget on page 1, excluding reserves, FY24 expenditures are increasing a little over $372,000, and revenues are increasing nearly $189,000. The department historically does maintain a very lean budget, and what we'll see is a lot of the increases this year are due to personnel services. So moving on to the bulleted items, starting on page 2, personal services are increasing by nearly $434,000. This represents the 3% salary adjustment on the midpoint for all employees, along with state increase in retirement contributions. This department is also requesting an increase in overtime costs due to animal enforcement officers that are on standby when they receive calls for assistance from law enforcement or fire departments for injured animal pickups. In addition to these factors, there are career path increases, a long-term employee that's planned to retire in FY24, and an addition of 3 county temporary staff to operate the additional overflow shelter at 49th Street. So to add more context to that, the renovation, excuse me, the renovation of 4 buildings at the Animal Services Almerton facility is, I think, set to start in about 2 weeks. So in anticipation of this, the department has opened an additional facility on 49th Street, and that's to shelter dogs that exceed the Almerton facility capacity for the duration of the renovation. So the shelter on 49th Street is a county-owned facility, so the department only required funding for equipment, medical supplies, and staff. And with that, 3 county temp staff members will be hired later this fiscal year in FY23, and that's to operate the overflow facility. So for added clarification, Animal Services has seen a slight uptick in the number of dogs that are being brought to the shelter, right around pre-COVID levels, which we haven't really seen in 3 years. So as a result, the daily population already exceeds or nearly exceeds the projected shelter capacity, and that's without accounting for the pens that will need to remain vacant during the renovation. So this has brought about that need for the 49th Street overflow facility. But the department is making a very concerted effort to get these animals adopted. So when I say later on there's decreases in animals, it's not necessarily that there's decreased animals coming into the shelter. It's that the department is making a very concerted effort to adopt them out and get them out of the shelter. So operating expenses are decreasing just over $64,000, and that's due to that decrease in the animal population and resulting reduction in the need for animal and medical supplies. Rabies licensing fees revenues are increasing about $200,000, and that's due to an increase in user fees that was implemented in FY23 for market alignment. Contributions revenues are decreasing nearly $27,000, and that's due to a reduction in the number of stores participating in cat adoptions and the reduced number of cats available for adoption. Animal control and shelter fees are decreasing over $11,000, and that's driven by this reduction in the animal population and resulting revenue from animal adoptions and reclaims. So the department has 2 proposed fee changes, and they're shown on the table in the middle of page 3. The first is a proposed increase to impoundment fees for unsterilized animals recovered by the owner, and this is to adjust to the market rate of providing those services and related supplies. The second is a proposed new fee for retail store permits that is actually being split out from the pet dealer fee that we were charging last year. The proposed increase amount is to recover staff expenses for enforcing that new ordinance that was introduced in FY22, and that affects 6 retail pet stores. I'll now pass the conversation over to Doug, starting with accomplishments at the bottom of page 3.
Good morning, Commissioners.
Good morning.
So Belinda summarized our budget pretty well. To give you a little context on the renovations that are starting in a couple of weeks, it is a penny project to bring all of our 4 animal housing buildings up to current code, harden them for storms, replace the kennels that are close to 30 years old, and to provide air conditioning in those buildings as well. During that process, our capacity for housing dogs is going to be cut by more than 50%. So we will only have a capacity of 122 dogs in our facility currently once the renovation begins. So we've got 40 kennels set up in a surplus warehouse that is also air conditioned over on 49th Street, and we've got it equipped as a temporary kennel. The difficulty is we then have to staff 2 locations, which is why we would need those 3 temporary staff just for the duration of the project. Our dog population right now is running about 120 dogs on the average day, so we're teetering right at what our capacity will be once construction begins. So that's context on that. Some of our accomplishments for the year, we have increased our active licenses to date of 206,521. We have a 41% compliance rate for pet owners in the county for rabies vaccination and licensing. To give you some perspective, this time last year, we had 199,000 active licenses. So we've increased it just right at 6,000 licenses in the past year. We've maintained our live release rate through fiscal year 23 to date. We have a 78% live release rate on cats, which is a phenomenal increase over where we were 2 years ago. Our dog live release rate is at 84% for a total average release rate of 81%. This is important because this shows the work that the community and our staff are doing to get animals that come into the shelter either back home to their owners or rehabilitated and back out to adoption, rescue, or foster so that they leave our building alive and we do not have to euthanize them for space or for medical reasons, which is some of the things we used to have to do before we had full medical capabilities. Also, our community outreach program is doing a great deal of collaboration with our enforcement division, and Jay McGill, our enforcement manager, is here with me, to get animals back into the homes of people who don't know how to be responsible pet owners, so they're working with them to teach them to be better pet owners, more responsible owners, and keep the dogs from becoming back and being frequent flyers with us. They're also getting some of our donations for pet food into the food banks, so that keeps a lot of those animals from coming into us as well, because if they've got ample food and the dogs stay healthy, they don't have to come to us, and that keeps our intake down as well. We work with 117 rescue organizations along with our 5 shelter partners, which are the SPCA, Humane Society of Tampa Bay, Pet Pal, and Friends of Strays, to get the animals that we can adopt out back out to the community through those resources as well, because doing it alone would be beyond our capabilities. So those partnerships are integral. We're also working closely this past year with Human Services and emergency management or emergency and safety to get animals who come into us through police calls and medical calls. Previously, a lot of those owners would get transported to jail or to the hospital, and we wouldn't have any contact information to get those pets that we take in during those calls back to their owners. We've worked with those 2 departments to have better communication and get that information up front so those animals can be returned within the first week, so that we don't have to keep those animals in our care either for adoption or for euthanasia. So that's had a very positive impact on our returns as well. This past year with the Animal Welfare Trust Fund, with our voucher program for sterilization and vaccinations for low-income pets and the pets of veterans, we've assisted 285 cats and 194 dogs that belong to 400 families, which is an update from the numbers that are in your current literature. And we also performed 4 mobile clinics out in lower income areas of the county. We've done 4 clinics so far this year, which has assisted another 150 pets that received low-cost vaccinations and microchips so that they could stay healthy and also not have to come through our system as well. We also are providing dog houses through the Enforcement Division to folks who are trying to become more responsible pet owners and be compliant with our ordinances. And by giving them shelter that is proper for the dogs, then the dogs do not have to come into our shelter if we have to confiscate them for not being compliant. We don't have any county-level active work plan items right now, but we do have 24 department-specific work plan items that we are working on a regular basis. You can see on page 4 a number of our performance measures that we work on diligently on a regular basis. Most of these are to get animals in the community licensed and to get the animals that come into our system back out to homes, either their original homes or adoptive homes, as quickly as possible. Our volunteers hours are staying pretty consistent at about 24,000 volunteer hours a year. We've got the 2nd largest volunteer group in the county. Any questions on any of those items for us?
Commissioner Scott?
Thank you, Madam Chair, and good morning, Doug.
Good morning, sir.
On the work plan,
Yes,
you've
sir.
got an item here that says on hold, evaluate mobile medical units for use once retired for animals. Can you talk about that a little bit?
We currently use an adoption trailer for our mobile clinics, which is really not a device that was built for performing mobile vaccine clinics out in the community. So we've kind of made it work. Human Services has their mobile medical unit that will be replaced in the next couple of years, and we're going to evaluate that because it's built for that purpose. Right. So we are going to look at the condition of it and see if we can repurpose it to make our mobile clinics more productive when the time comes.
Perfect. And one other follow-up question. It's on page 2.
Yes, sir.
Where is it? It says, the fiscal year 24 budget operating expense reflects a decrease of $64,190. Primary driver is decrease in the animal population.
Yes,
so can you talk about that a little bit?
Well, our dog population has shown an uptick this year from pre-COVID levels, but our cat population is still continuing to decline. 2 years ago, we've taken a number of measures to deal with the cat population over the last few years between TMVR, rescue partners, and the Return to Field program. So those are running full force now, and they're showing continuous improvement. And so our cat population is continuing to decline as far as animals coming into us because our partners and owners are being more involved in the process. So we're not taking in near the number of cats that we're having to euthanize that we did years and years ago. So that's been a continual decline over the last 2 to 3 years.
Cool. Great, thanks.
Anyone else? No? I have a couple questions, Doug.
Yes, ma'am.
Do we still have as many cat colonies as we used to have several years ago?
I'm assuming they're stable. There's not any real way to quantify it, but we're continuing to spay and neuter between our efforts and our partner efforts throughout the year. We're sterilizing probably several thousand cats a year. So there are not as many kittens being born, but as far as the number of colonies, we don't have a quantified number on that.
And my last question, and I almost hesitate to bring it up, but there's not one word in your presentation about rabbits. I can't help myself.
Because we do not get calls for rabbits, and we do not offer services for rabbits. Our partners offer those services.
So you don't get calls on rabbits?
Very rarely, and if we do, we refer them to the SPCA.
And do they have a bunch of rabbits?
Last year, I think, if Jake can correct me, I think they received and adopted out about just under 300 rabbits last year.
How many?
300.
Oh,
And the majority of those were owner surrenders.
interesting. Okay, that's all I had.
Thank you.
Anybody else? No? Okay, then. Now we are on to Safety and Emergency Services. Thank you, Doug. And thank you. Aren't we, though?
Hey there, Jody.
So we have Jim Fogarty and Jody Seschler coming to the table over here. Again, good partners all around. Thank you, thank you. And John Ondrovic is back from Office of Management and Budget, going to present this side and then turn it over to that table. It's a very complex budget, so we're going to go a little slowly through some of the things that are in here.
That would be good, because
okay?
it is a complicated system.
There's a lot of restricted funds in here that have specific
So
specific
welcome, Jim,
things.
and say your name again? Jody, nice to see you. Thank you for being here.
Go ahead.
All right, so the Safety and Emergency Services budget consists of 4 funds. It's the General Fund, the Emergency Medical Services Fund, the Intergovernmental Radio Communications Program Fund, and the Emergency Communications E911 Systems Fund. Between the 4 funds, the department is proposing reserves of $74.6 million, which is 15.7%, and that's in the non-general fund funds from FY23 budget. Excluding the reserves, the expenditures for the department are increasing $14.9 million, or 7.9%, and that's from $187 million to $202 million. Now, on page 2, we're going to go over the budget drivers. And for the 24 budget, this includes a 3% annual adjustment for the midpoint on all employee salaries, and also for increases for career paths and ladders. That equates to about $909,000, or 4.5%, from $20.2 million to about $21.1 million for the department. Also includes increases of $8.8 million for the ambulance contract, which is going from $65.3 million to $74.2 million, which is about 13.5%.
And Commissioners, on that, that's what we went through last year, and that's until that contract ends, which is next year, correct? So that'll be rebid next year, so you'll likely see a big, significant increase beyond that.
What was the last part of what you just said?
So when we ran into issues with the contract, they couldn't hire people. We negotiated a modified agreement with that, and we shared in the cost of implementing those modifications with the company. It'll be rebid next year, and I'm sure that whatever that bid amount is will reflect the market rate of the employee, what's driving the employees' wages. So you're seeing an increase of $8 million here. You'll see another $8 million next year in that contract. That's what we're predicting.
Wow.
And Commissioner, some
Hold
of that.
on, Jim, hold on one second, please. We'll probably have a lot of questions on this issue. Commissioner Scott.
Thank you, Madam Chair. Isn't the clerk have an audit scheduled for Sunstar this year?
Sunstar?
Yes, that's correct. There's an audit scheduled for Sunstar, but much of this is driven by call volume. The call volume that occurs as we transport more people to the hospital, we have to increase the budget to pay them to do that.
Medical supplies.
And right, also medical supplies. So the system handles our medical supplies and call volume, and so the budget increase is not strictly contractual, although some of that is. But
Okay.
Is that it? Any more questions at this point? No? Okay, please continue.
All right, the budget also includes an increase of 1.7 million, and this is for approved vendor contract costs to the EMS fund. Also increases include 3.7 million from 68.3 to 72.1, or a 5.4% in the grants and aid section, and this is the first responders agency funding contracts. And these are costs, the actual costs identified through resolutions 09.37 for the EMS level of service, and resolution 09-38, the reasonable and customary costs in the EMS fund as well. We're also showing increases in memberships of 952,000 for the electronic patient care and computer aid dispatch record management system in the EMS fund. Currently, the millage rate for the EMS is 0.8775, and they have some enhancement requests for potential first responder systems. The first one is a traffic preemption one-time cost of $2.5 million. The second one is Squad 36 Pinellas Park. It's a recurring cost of $405,500, and that's to meet the resolution of 09-38 level of service. The next one is Medic 52, Safety Harbor. It's a one-time cost of $100,000 for a pilot program. Rescue 69 for Tarpon Springs. It's a recurring cost. It's going to be in phases. The 50% for FY24 comes to about $308,000, and it'll be $630,100, which is the other 50% plus an inflationary factor for FY25. The St. Petersburg First Responder Services staffing is incurring costs in phases of 50% from $500,000 in 24 to $1.2 million in FY25. And that's 50-50 because it's the 50 and 50, the 500 and 500. And then Largo Medic 42, it's a civilian peak unit. It's recurring costs beginning in mid-year of FY24, about $200,000, with $400,000 recurring in FY25. Now, based on the current millage of the 0.08775 with those enhancements, the chart that is on page 3 gives you different scenarios of the different millages that could be used to include those enhancements and what the forecasted fund balance would be after year FY30 based on the 12.15% increase in the EMS fund, and also scenarios if we go to a rollback rate or somewhere in between the rollback rate.
So could you hold on for one moment, please? I'd like to stop right there. And Jim, I know some time ago you and I spoke about the pilot program in Safety Harbor, and I'm very curious. I can't remember from our conversation when that started or how long it's been in effect, and whether or not you're seeing any benefits from it.
This particular is a new pilot program. We met with the Chief Stefanik and its city manager, and they've identified a high-level call volume in the southern Safety Harbor, eastern Clearwater area in terms of response times. Their proposal was to test the idea if they could match the unit hours, putting another unit in service rather than putting it in 24/7, if they could match it based on the demand in that district. So that's the pilot. To staff a unit on variable hours, Monday through Friday, 9 to 5 type thing, and see if it can make a difference in dampening the increase in call volume in the Station 49, Station 52, and Station 53 corridor.
And so how long has that been going on?
Well, assuming that this is approved, it'll start in October. That has not
Oh,
started.
so you haven't started it yet?
That has not started. This is
Oh, I apologize. Somehow I got the idea that it was already implemented, and I was just really curious how it was working.
We have other pilot projects that say, you may be referring to the medic unit. They've got a unit that they do variable staffing with. When they have staffing, they can put it in service, as opposed to putting the people on a fire truck, they put the people on a medic unit.
And who is they?
That's Safety Harbor Fire Department.
Oh.
So that may be the pilot you're thinking of.
Well, aren't they getting creative?
All fire departments are getting very creative in how to provide services, without exception.
Good. Good to hear. Okay, I'm sorry to interrupt you. Go ahead. You were talking about the millage rates.
Yeah, keep going, John.
Excuse me?
I said, go ahead. You were talking about the millage rates.
Should I continue? Okay, so do you want me to include millage rates or not?
So you can see all the millage rates that are there. I don't think we need to elaborate on each one of them. So with your permission, we'll go on to the bullets that are right
Yeah,
underneath them.
I was just bringing us back to where we left off before
Thank
I
you.
interrupted you.
Thank you. All right, the FY24 budget also includes increases in their revenues of 5.2 million from 46.7 to 51.9. This is an 11.1% increase, and this is for the ambulance service fees collected for the EMS fund. And also an additional 1.8 million from 15.8 to 7.6, or 11.4, for the ambulance service fees for the Medicaid. That's also in the EMS fund. As I mentioned before, the proposed budget includes reserves increase of 10.1 million from 64.5 to 74.6, or 15.7 for the department. Now, I've also included in here a history of the fire districts and what their millages are over the period of time for your informational purposes. We have not calculated anything for FY24 yet, and the fire department budgets are not part of this budget. So Safety Emergency Services has a couple of decision packages. The first one is for a temp employee. This is for a law enforcement call quality assurance person. It's to maintain the customer service levels and the need for a temporary employee to perform reviews of the law enforcement related 911 calls. The second one is, that's for $26,250. It is a general fund and currently is recurring for next year. The next one is live 911 for EMS, fire EMS agencies. The EMS is planning on funding $94,770 of it, and the general fund $10,530 as a recurring expense. And this is software that allows responders to access the audio of the 911 calls as the 911 call is being processed in the communications center. And the next one is the fire EMS traffic preemptive system. It's going to be funded out of the EMS fund. It's a non-recurring one-time of $2.5 million. And this is for the existing traffic preemptive system, Opticom. It's at its end of its useful life, and it's technologically obsolete. Can't say that word. Okay. The department is proposing several proposed user fee changes, and they're right around the 3%. And that you can see those on page 6. And then at this time, I'm going to turn it over to Jim for the accomplishments.
Thank you. Jim Fogarty, Bureau Director, Safety and Emergency Services. You know, when I was preparing to do budget every year, I remember what my father told me when I started in this business 50 years ago. He called me James. He says, James, you can spend your money however you want, but when you're spending taxpayers' money, you got to watch out for it. He says, watch out for the pennies, and the dollars will watch themselves. Well, over 50 years, I've come to learn you got to watch out for the dollars too. And so I'm presenting a budget that watches out for the pennies and the dollars. I want to acknowledge my team, Jody Seschler, who's Director of Financial Services. Behind me, I've got Dave Hare, Deputy Director, who was prepared to do this, should for some reason I not be able to show up. Judy Wasinski-Price, the Regional 911 Director, and Craig Hare couldn't be here right now. He's at the Medical Control Board meeting. So I wanted to quickly go over some of the accomplishments. You know, what you've done is not as important as what you need to do, so I'm going to limit the number of accomplishments that I report on, because the lion's share is what are we going to do in the future. Over this last year, we've done a lot. For instance, the folks that work for Jody with ambulance collection fees have increased the revenues by 13%. That represents $13 million. Now, these folks are not on commission. They do it because they're passionate about what they do. There's pages and pages of workflow improvements and divide and conquer improvements that resulted in that $13 million or 13% increase. Jody whispered in my ear just before the meeting started, they've got a goal to do even better this year, and they think they can reach $80 million. I don't know if they can or not, but boy, will they be asking for raises.
And Jim, I just want to point out that the increased ambulance costs, I just want to point out that the increase of the ambulance contract is anticipated to be paid for with those ambulance user fees.
So the way the system's designed, we collect the revenue from the people using the ambulances to pay the ambulance. But also, in terms of accomplishments, that team has successfully passed 15 audits. Now, when you get audited in the medical and healthcare billing realm, it's a pretty detailed audit, and they successfully passed over 15 of them. One of those audits was an audit wanting to know, why are you collecting so much money? Typical ambulance collection ranges are 20 or 30%. She's approaching 80% in collections. And so that was one of the audits. They said, we think there might be some overcharging, and that's not true. She passed flying colors. In terms of support services, the division that Dave manages, you may recall 3 years ago you added an FTE for our department because we had a records request backlog for 30 to 45 days. I'm here to report that if you offer and request a record from my department, it takes about, on average, 2.5 days, and they processed over 629 per month, each month and every month, and that's just increasing. We're also the pilot agency with the county to do eGov, and we're looking forward to sharing out what we learned from that. We also improved the radio system. Matter of fact, you passed a local ordinance, a local resolution, I'm sorry, that acknowledged the radio system standard that we have. And I'm happy to report that the fire marshals that are in the area that are now enforcing that are having conversations with building owners like Walmart and like Publix, where they say you don't necessarily need a BDA inside your building because your signal strength is proper. And we're seeing that over and over and over again. So we've got that consistent standard being enforced as of today. In the world of 911, we've improved our 911 answering time by 7%. The goal was to answer a 911 call in 10 seconds or less 90% of the time. Last Monday, we had over 2,000 calls, and we answered 100% of those calls in less than 100%. Thanks to the team. This Monday, on the 19th, we had almost 2,000 calls, and we were at 97%. So, and that's with the exact number of people we had last year and the year before that, because we remain having challenges staffing the 911 center. And so that was through an efforts of efficiencies and call task durations. We also reduced the number of vacancies by a total of 9 and reduced the mandatory overtime by 700 hours in the 911 center. Again, still has work to do. We measure turnover. The turnover you might have heard us report, and we still report, is in the 20s and 30s, but that is really from the time we hire them to the time they become an employee, the 1 to 2 year mark. If you look at our turnover from 2+ years, we're in the single digits. We're between 1% and 3% turnover for someone who's worked for us for 2 years and finishes their career after 30 years. So we're really below the industry average, but we still have work to do.
So Jim, can I interrupt you right
Sure.
there? So are you saying that it takes that long to train somebody up in the 911 center?
It does not. The training program takes about 10 to 12 weeks. Then you have to develop experience, and it takes about a year. So after about a year, folks have the knowledge and experience, and it's not for everybody. And you don't know that till they actually are on the end of the phone lines and dealing with that. So we have some work to do in terms of identifying the best candidate. With the workforce supplement pay that you approved this past year, we're starting to attract seasoned and experienced people to our center, supervisors that are leaving New York and coming to Florida and to work for us, call takers. And that type of a person already knows the industry and can kind of go to work with just a few weeks of in-service training.
That's good.
Still work to do. I want to move on. We've got, in terms of the EMS system, we've made improvements to the EMS system each and every year for the past years. We've put units up in Eastlake and Largo, Tarpon Springs, St. Petersburg, all at the same time while enjoying a reduction in millage. Last year was the first year for 10 years where we actually reduced the EMS millage from what it had been for 10 or 11 years down to what it is today. And then we've updated some key contractual relationships with several providers. Our Office of the Medical Director, Sunstar Ambulances, we still have work to do with that. We're never perfect. There are still challenges. And then I'll finish our accomplishments by talking about our relationships. We've got some fairly strong relationships. You've heard about some of them with Human Services and the Office of Management and Budget, but some of you may not realize, for instance, the relationship we have with Public Works. We were able to work with Eastlake and Public Works in mapping the hydrant system, providing the hydrant testing data, which would allow that fire department to get full credit for ISO ratings and accreditations. Eastlake Fire Department was very supportive of that. We partner with, that's with utilities. With the Public Works, we've studied the traffic preemption system. And the list goes on. We partnered with Administrative Services with helping the city of Largo site a fire station. We've worked with Administrative Services looking at the Pinellas Suncoast area to see if we can site a fire station there, with Layman, with Palm Harbor. The list is pretty exhaustive as we work with these various departments, with these partnerships, including our county administrator. The partnerships with the county administrator and my boss, Lourdes, we don't shy away from problems. We square off against problems, we look at them, and we figure out how we can solve them. And I think we do a good job doing that. Animal Services, Doug forgot to mention, he's volunteered his puppy dogs, I call him the puppy dog guy, to any fire service that has a critical stress call that can get an animal, a dog, out to that location and do a stress relief. And we found that is very effective over at the 911 center. And again, the list goes on, but I will not belabor that because your time is valuable. I wanted to talk lastly about the partnerships we have with the fire service. We've got a data-driven focus group. We meet monthly. We look at the data. We find the kinks in our system, and we try to develop new solutions to how to deal with them. It's a little bit of a mix of the old solutions and some of the new solutions. It's driven by the resolutions that describe level of service, what we can spend money on, and we do that not only for the EMS system, but for the fire system, and I can proudly report we've been able to reduce the fire millages in the dependent fire districts each year for the past many years. Those millages are going down. That's not accidental. That's because of the fire chiefs and the fire service spend a lot of time and effort to figure out how they can do services bigger, better, faster, and sometimes cheaper. But having said that, emergency services are not cheap. They're very, very expensive. You know that, I know that. So what do we have to do? We've got a work plan that's fairly extensive. You only see a couple of them here. There's hundreds and hundreds of things that we have to do. I'll just mention a few of them. We've got a major project that hopefully will turn on May of next year, known as the CAD Consolidation Project, which for the first time will bring all law enforcement, all fire rescue, EMS, including the ambulance service, onto a singular CAD. It'll allow a singular call taker to take the information and create a dispatchable event, where right now that requires transfers and requires multiple conversations and delay. We've got a lot of work to do. We've got a new records management system we're hoping to turn on. And that may sound boring to you, but to the field worker, the new records management system means they'll spend less time looking at a computer screen doing a records entry and more time looking at a patient in the face and dealing with whatever medical problems they have. We're hoping this new records management system will be, like all computers, bigger, better, faster. We hope that will be the case, and we'll spend enormous efforts to try to make sure that's true. We have some partnerships that we've got to develop with the sheriff in terms of the CAD, with the active assailant drills, the functional drills that we've been doing. We've got some work to do with our ambulance contractor in bringing that ambulance contractor back to excellent performance. For years, that ambulance contractor not only met their requirements, but exceeded those requirements, and along came the economy, COVID, et cetera. And they saw their time on task change from 68 minutes to 78 minutes to 88 minutes as they had to don these hazardous material suits and then decontaminate the ambulance. And all of that results in more time on task, fewer ambulances. So we have some work to do with the ambulance contractor, not only in staffing, but deployment methodologies. And the same is true for some of the fire service. And one of the things we're looking at now with the decision package, the traffic preemption, that's an effort to try and improve response times. We've been partnering with Eastlake along the McMullen Booth corridor and testing 10 intersections. And within 2 months, we've been able to, or at least Eastlake is reporting, they've been able to shave 56 seconds off response times. The average emergency call has 15 intersections, and the average intersection delay has 15 seconds. I'm sorry, it has 6 intersections and 15 seconds delay on the average intersection. So if this program is successful, it could improve response times not only for the fire rescue, and there's 105 fire rescue vehicles out there, but also for the some 100 ambulances that are out there. It'll hopefully improve response times and at the same time not clog traffic. At the old Opticom system, when it took control of the traffic signal, it took several minutes for that traffic signal to recycle back in. The new system hopefully will avoid that. And so if you're on US 19 and you see an emergency vehicle come through the signal, hopefully it can recycle in a more reasonable amount of time. So,
Commissioner Eggers.
On that issue, I thought when we were talking about that yesterday, it was fascinating that what we're trying to do, obviously, is get those first responders back in line sooner so that they're available for calls faster. And you're basically providing more product, if you will, more product service delivery by minimizing that time you're spending at these intersections. So I just thought it was a way to try to make our current system more efficient with technology.
You're exactly right, Commissioner. That's but one example. There are many examples. The records management system, if we can save 5 minutes on the 200,000 calls that we go on, that results in over 600 hours of extra unit capacity in our system just because we've saved 5 minutes per call. That's how Judith was successful in managing the 911 call intake. She shaved a few seconds off of each and every one of those 1 million calls, and that resulted in the potential for 8 extra employees, even though she didn't have any extra employees. And there's any number of those technical solutions that we're proposing, and I think we'll see some results from next year.
Thank you, Judith.
Anyone else? No? Commissioner Scott?
Thank you, Madam Chair. Can you talk a little bit about the membership program? Is that catching on, taking off?
We've had challenges with the membership. The membership program, and I probably should let Jody answer this. She knows 10 times more than I do. You know, the brains and the muscle of the organization are behind me. I'm just the face. But the membership program is required to be actuarially sound, and so the rate we charge has to cover the costs of the benefit, or we violate some Medicaid, Medicare rules. And so we've had some challenges because folks tend to discount it. It's okay. It's just, but you see it creeping up year after year after year. We've done marketing outreach campaigns, and to the public that's listening, it's a really good deal. If you want to sign up, there's a family rate and there's an individual rate. And if you do have recurring medical problems, it requires you to go by ambulance to the hospital more than just once. It's a heck of a deal. But yes, we've had some challenges with increasing the membership.
Any idea how many subscribers we have right now?
I'm sure Jody does.
About 2,500.
In a county of 1 million, that's not a lot. Okay. Thank you.
Any other questions? Okay, thank you so much. We appreciate it.
Commissioners, if you want, we can move general government, which is scheduled for tomorrow afternoon, and we can go ahead and move it up to now if you're interested.
You all up for getting out early tomorrow?
You want to stay out? So lunch is ready, but we're ready to do general government. So it's kind of your call.
So is everybody okay with waiting on lunch and doing general government?
Yep.
Yes? Yes. Is that all right?
All right.
Okay. General
Jim, you're
government it is. So that's on tomorrow's number 5 agenda?
Correct. That'll take care of number 5, so should be able to get, like I said yesterday, not planning on ordering lunch tomorrow. Commissioner Justice feels otherwise because you got the sheriff, but I have faith, so we can always order pizza if we need.
And we did take care of Office of Management and Budget, which would normally be up right now. So we've done that, and it looks like we're only going to have three to present tomorrow, if all goes well here.
Good morning, Commissioners. I'm Jim Abernathy with the Office of Management and Budget, and I'm here to present the FY24 budget request for the General Fund and for General Government. The General Fund includes the primary governmental functions of the county that are not completely supported by dedicated resources. The activities include, but are not limited to, Sheriff's Law Enforcement, Detention and Corrections, Human Services, Emergency Management, Communications, Parks, the Board of County Commissioners, the Office of Management and Budget, the Property Appraiser, Tax Collector, Supervisor of Elections. The General Fund includes operations for both county-wide functions as well as the unincorporated area. Funding comes from four main external revenue sources: property taxes, state shared half-cent sales tax, state revenue sharing, and communication services taxes. Total revenue in the FY24 budget request increased $78.7 million to $820.3 million compared to the FY23 adopted budget. Ad valorem revenues, which make up approximately 75% of the total general fund revenue, increased $63.8 million to $612.2 million. This is driven entirely by the growth in taxable values as reported by the property appraiser on May 30th. The taxable values will be updated by July 1st, the final update before the budget is adopted in September. State revenue sharing revenues increase $4.9 million to $26.1 compared to the FY23 adopted budget. Also compared to the FY23 adopted budget, the local half-cent sales tax revenue increases $6.9 million to $56.5 million in FY24. Now on page 2 of the document, the FY23 budget was developed with many uncertainties regarding the state of the economy and expected recession that hasn't materialized. Total revenue estimates for FY23 are projected to increase $33.9 million compared to the FY23 adopted budget to $775.4 million. The biggest driver of this increase is the state revenue sharing and local half-cent sales tax revenues. These two revenues are up 29 and 19.6% respectively, a combined increase of $15.8 million in FY23. Communication service taxes continue to decrease this year, $111,000. This is due to the trend of the number of taxable landlines reducing the revenue sources for the county. Another large source of external revenue, if taken as a group, is sheriff-generated revenues. The sheriff collects revenues from various sources, including the many municipalities who contract with the Pinellas County Sheriff's Office for law enforcement services, such as Dunedin, Madeira Beach, St. Pete Beach, and others, along with the U.S. Marshal Service. These revenues, along with grants, help offset the need for ad valorem revenue to fund the sheriff's annual budget. In FY23, sheriff-generated revenues increased $1.3 million to $39.7 million. FY24 budget requests for expenditures increased $53.8 million, or 6.9%, to $830.3 million. You have heard or will hear soon the details of these increases from each of the departments as they presented their individual budget requests last week and over the rest of this week. Personnel services, which include salaries, benefits, FRS, and payroll taxes, increased $5.4 million. Included in this increase is a 3% general increase in salaries on the midpoint of each pay grade, a 13.8% increase in FRS rates for regular class employees, and a 10% increase for employer-paid health insurance benefits. Operating expenses increased $3.6 million to $152.1 million. This 2.4% increase includes efficiencies departments have identified during the budget development process to account for inflation while maintaining the current level of service where possible. I will detail more of these expenditures when I review the general government budget request in a few minutes. Transfers to constitutional officers, including the sheriff, clerk of the circuit court, property appraiser, tax collector, supervisor of election, and accounting support for the courts, increased $42.5 million, or 9.6%, to $485.1 million. These expenditures account for 58.4% of the total general fund expenditures. Transfers to the sheriff's office increased $40.2 million, or 10.7%, to $414.3 million. The sheriff's budget comprises 49.9% of total general fund expenditures. Accounting for the sheriff's generated revenues, this is equivalent to a millage of 3.024 mils, based on the taxable values reported for June 1st. Based on the FY23 countywide millage of 4.7398, this is 63.8% of the total countywide millage. FY24 reserves are $239.4 million, which is above the proposed reserve policy of 20.8%. This is the end of my analysis for the general fund portion. When you're ready, I'll go on to the general government portion.
If you want to take questions from that.
Well, I apologize for being a bit confused. I obviously didn't do my homework because this is a really complicated
So if I can, commissioners, you know, this is the large portion of just general government, and it covers all of the areas that, and so what you're seeing is, you're seeing what we've discussed over the last couple months. We're seeing huge increases in the need to cover the sheriff's office. He has mandated increases through the Florida retirement system and things like that. Well, it's going to be coming out of general government for covering those costs, and so that's what this is. It's not like a department budget where, you know, I have a need, and, you know, and here's what it is, and here's my accomplishments. This is kind of the overarching issue. This is where the sausage is going to be made between now and a month from now, when we try to balance a budget, because this is where the adjustments will be, and we have to decide, within all the different things that you're hearing, how can we balance within our overall tax structure, fee structure, you know, and things like that. So it's a lot of information, but it's kind of overarching.
And I get that, except that I just wish I'd have known we were going to take this up today, so I could have read through it and been a little more prepared. And I also think it would be very helpful. Have you and your staff already begun to talk about recommendations that you're prepared to bring? I mean, I don't know how we have an intelligent conversation about this without hearing where we are at the end.
Well, and we're not there yet. And so, you know, we have now until we adopt a budget prior to October the 1st. And so we're kind of putting everything out there, and we're showing you what the departments, you know, where you can hear directly from them what the request is. I will tell you, it's not hard math to figure out that the requests exceed the revenue. And, you know, that's the hyperinflation we've seen, that's the salary demands, that's separate from the decision packages that are requested. And so we're going to have some tough choices over the next month. We have plenty of time to have any of the discussions you want to have. If you want to meet individually to go through anything, we are at your beck and call, and we'll meet with you however and whenever you want. As soon as we get done today, that's going to be our first meeting to start talking about what we can pull together. I've got Chris working on various analysis and alternatives and ideas, but I don't have a recommendation yet. That's really going to, we're just now pulling that in. A big piece of that recommendation, unlike, if everybody reported to me, is I have a sheriff where he has about 50% of the budget. And so I've raised these concerns and issues, and he's working on option alternatives. So it's a collaboration and it's a partnership on how we get to an end where we can balance a budget. And so we're working through those issues, but I don't have a recommendation at this point. This is just laying the foundation. Here are all the facts. Now we can come back and get to some specific recommendations.
So Chris, have you gone through each one of these presentations that we've had over the last 2 weeks and looked at the opportunities in each of those budgets where we might be able to use one-time money to take care of it and maybe not add it in like we did? I don't even know if that's a good question or not.
Yes.
Yes, we have.
We look, and that'll be part of what we solve as we talk about that. If you notice in each of the decision packages, we ask whether it's recurring or not. Because things that are one-time cost don't have a recurring cost. We have one-time money to pay for that. We also have some things that we need to look at and I tried to raise those during the budget. Last year when we identified a pent-up demand for increased expenditures in road funding. Specifically, the penny takes care of a lot of our base level of funding, but our local roads, and we've heard that from our citizens too, about the need for more money into local roads. So we have some opportunities where it's not reoccurring. Same thing, I'd love to know what it cost us to update our technology in our traffic lights. So there's some ideas and stuff that we're floating around that where we can come back and have those types of discussions with you when we try to formulate exactly how to manage a budget. But we're going to pull everything out that can be one-time money in things and make recommendations to you of how to not bake that into the overall budget and pull those out. Several of those we've done during the meetings with the departments where we've actually advanced those and gone ahead and paid for those this year. And advance those items too and take them off. So some of the things that would have been decision packages have been removed before it even gets here.
Commissioner Peters, you had something?
I do. So just that last bullet point on the reserves. So if the reserves are, over our policy of the 20.8%, have you made a decision on that?
No, that's what I was referring to.
That's what you're referring to. That's what, as you were answering that, I thought you were answering my question, but I thought I would just make it clear. So you're going to be looking at with all the pay increases and the FRS increases that you'd be reducing that millage?
Well,
or that reserves?
The reserves are one-time money. Okay, so if I let's just say I take it down to the 20.8% or whatever policy you set that at. Well, if I put that money to pay for salaries, for instance, well then next year I've got a gap.
I got it.
Right? Because it's not reoccurring. You spend it down and it's gone, unless a revenue source generates more money to be able to cover it. So I've got a gap next year. I can't use it for that, but I could use it for roads. I could use it for technology, for upgrading lights. I could do it for some of the priorities that you've set in your strategic plan and what we've heard from you on. So I think that's a discussion we need to have around our reserves to where we can make sure it's sustainable over time.
Okay. Thank you.
Commissioner Eggers?
Just a clarification for me. This proposed reserve policy of 28.8%.
That's what I said, whatever you decide to set it at.
I'm sorry, I just want to make sure that we hadn't done something that I missed.
No, okay. Commissioner, whatever, we talked about that, but that's something we should discuss and you decide. And whatever you decide, we'll certainly implement.
Okay, thank you.
Anybody else?
But I think your comment about figuring out how we can put less pressure on the general fund through careful uses of our reserves to do one-time expenditures is really a big part of this exercise. Mm-hmm. To try to take some pressure off of these increase in costs that we're seeing all over the place.
And I want you to know that we're looking at that very, very hard. For instance, we know we're seeing employee turnover, and that's because people are, stealing people right and left because they have a hard time finding skilled workforce, and we have a very skilled workforce. And so even looking at trying, we need to and continue to recognize our employees and pay more, but we also know that the employees appreciated the one-time bonuses last year versus everything going into base pay. So I don't know, and that's something we're discussing internally. We absolutely need to recognize our employees, and it needs to go into their base pay. But maybe a portion of that could be one time, right? And then, and to your point, then it doesn't put pressure, and that way we can fund some of the other things. So we're looking at all those.
And then just a little reminder over the last couple of years that we've added a couple of millages for different things that are now embedded and are part of our overall millage. Now, I just want to kind of just revisit and just check off if we're still okay and what that means. Part of it was for the gas tax fund.
It's Transportation Trust Fund.
Other part of it was for some improvements of some infrastructure.
Both of them go to the Transportation Trust Fund. One was to shore up the Transportation Trust Fund that was running out of money. And then that helped us get our sidewalk crews and stuff to be able to maintain. And then the other was to attack bridge and roads. And that's the local road package that you've seen. And so they've been able to expand the amount of local roads that they can rehabilitate.
But there has been an impact on the use of a higher use of our penny money for those roads because of the ARPA funds. Have allowed us to move more into that. So I just want to make sure that we understand that those pieces. So because they're both adding to more roads improvements, more sidewalk improvements.
Except costs have gone up so much.
Whatever.
The cost to do a lane mile road has increased so much. So I understand your question.
I just want to make sure we understand it and see what they're each bringing and why we want to keep it or not. I mean, I think it's important to understand it. So.
Yeah. Okay. We can do that. We'll give you an update here in the future on how we're doing with the road fund. How we're, but remember when we did it last year and we put that amount of millage over to Transportation Fund, Trust Fund for Roads, we said that it was a 9-year, that if we increased it 36 million, it took us 9 years to get rid of the backlog. We increased it 18 million, half of it, and because that's what we decided. Hopeful that we would have the increment to be able to make that remaining amount this year. We're not going to have that. We've just got too many other pressures on the millage amount to be able to accomplish that. That's the reason I'm trying to think maybe about a way to at least fill that gap is some of the one-time money that we see out of our reserves, depending upon the level you set it at. Because we know that backlog in local roads is where it's at. When Kelly has a choice and we set aside, and you've seen we've pushed more penny money into roads, but she's got to take care of Belcher and major roads like that before she does local neighborhood streets. That's the hem and the haw that we need. So putting more money into local roads is a really good long-term idea.
Yeah, and then obviously delivering when we say that we're going to plan to do that, because that's really neighborhoods that have been waiting decades to get work.
Have.
And then all of a sudden it's like, well, we're going to kind of push it a little bit. So it's to your point about making sure we have the funds to do it.
And you and I have had that conversation. For the rest of the commission, sometimes we've made promises and then contractors can't deliver within the time period of which we thought they would be able to bid and get things done. So there's a lot of issues. We've really worked with communications to where embed them into the departments. When they're talking about a project, they're there at the table hearing about it, to where they can think about how to communicate with residents. When changes occur, to communicate with the residents and do a better job of managing expectations on these projects. So that's something that we're going to continue to work on and refine as we go forward.
Okay, so are you still presenting?
I have the general government portion of the presentation. The general fund portion was the culmination, as Barry said, of all the departments that use general fund money That was the total fund which collects the ad valorem tax. The general government is a smaller piece that covers things that the departments don't cover. So that's the rest of the presentation.
Okay, we'll continue.
So the general government is a non-department category, which aggregates and allocates countywide funding needs that benefit all departments and agencies, as well as unincorporated areas, the MSTU expenditures, the Municipal Services Taxing Unit. Major grant programs such as FEMA, Public Assistance, and the American Rescue Plan Act are included in general government. Even though ARPA is its own fund and not part of the general fund, it is housed in the general government part of the budget. So please turn to page 3 of the document. In the general fund, FY24 expenditures increased $2.6 million to $105 million, excluding reserves. Professional services increased $150,000 due to the need for a charter review in FY24. Accounting and auditing services are increasing $30,000. This is used mainly as part of the annual audit of the county's financial statements. Other expenditures, including general government, include the BTS charges for all general fund departments, currently budget at $28 million. Payments to municipalities for the TIF district throughout the county at $25.4 million. Memberships to organizations such as the Florida Association of Counties and Tampa Bay Regional Planning Council, as well as general fund reserves, are in general government. Also including the FY24 general government budget is a transfer of $32.2 million, which are the 2 dedicated millages to the Transportation Trust Fund. As mentioned already, the total general government budget also includes the ARPA grant. Expenditures increased $72.6 million, which is over 340% to $93.8 million. The biggest majority of this request is for future projects, and that's they budget everything that is within the grant in the current year, and they know they're not going to spend it in this current year, and it's identified as future projects. So that's why that amount is so much. They're just accounting for everything that is available, and they'll obviously only be able to do what's within the scope of their various contracts.
Question. Is there a sense of how much of the money that we're getting for ARPA is taking the place of some of our penny planning? I mean, is there a sense of, like, all $70 million is embedded in our penny, so it's a dollar-for-dollar replacement? Or do we, I know some of it may not be eligible, so just curious.
Well, we did move projects around because of the requirements in ARPA. And we brought those to you. So penny would have been out of balance. We wouldn't have been able to complete it without be able to use some of the ARPA dollars just because of the cost we're seeing all these bids. But we were able to be able to use money down in certain targeted communities that freed up dollars to be able to complete projects in non-target communities. Just because of the requirements, it was easier to do in meeting that. The biggest concern I have with the ARPA dollars is we got to be able to deliver on them. And your capital, CIP team, when Jackie was here yesterday, that they raised that concern. We've really got to get busy, and we got to be able to deliver. And it's really hard to get contractors on board even now, just because there's so much work out there. So they're monitoring it. But yeah, I can probably have Jackie pull out and give you a better sense of kind of the deferred piece. But a lot of it was additions, things that we wouldn't have been able to get to.
No sense yet of whether that will be extended, that period of time to.
So far it is not, but Chris?
Yeah, no, it is, we're being told not to count on it, is what we're being told. I'm on a call every other week with National GFOA about this very topic, and it is lining up to where the deadlines are not going to move, is what we're being told.
So
the CIP team that was in here yesterday, they're going to be all over making sure these projects are delivered and done, because we are not going to turn money back. And if there's things that on there that we can't do, then we may have to come back to you and try to substitute those things where we can encumber the funds.
At the end of the day, we might just have to have that one project that we have to get started. So that we, I've always, one time I remember saying, let's, if we're not going to use it, we can't use it, let's send it back. And of course, everybody looked at me like I was nuts, and perhaps I was. So at this point in time, if everybody would do that, there might be a different issue to deal with, but that's not going to happen. So finding that one project is kind of our safety release. If we get into a bind, might be important. I don't know what it is, but
go ahead, Chris.
And just so you know, ARPA has a number of strings attached to it, and the strings have been changing as time has gone on.
That's
too.
good.
Yeah, so it's kind of a step forward, a step back, but we are right on this issue, and even in this budget, you're going to see things that are moving around so that we can move things forward faster with ARPA and get it out the door. We're very conscious of
So
this.
when you say things are changing, in what way do you mean?
So this past
December. Is that
December,
bad? I mean,
some of both, honestly. This past December, there was an amendment passed in Congress to ARPA called the Flexibility Act, and it came with some flexibility and some lack of flexibility. There were things that we had to adjust to, and in all candor, the Treasury Department has not come out with additional guidance on how to implement some of that. So we kind of have to make up our own rules as we go and assume that we're doing it right. And I can't put words in their mouth, but I'm not sure Treasury's going to come out with additional guidance on this. So we kind of have to make our decisions and move forward with it.
And
that's
when you
what
go
we're
into
doing.
a project, you got to know whether you're doing it under ARPA or not, because you got to bid it that way. And if you don't have those requirements in, then it's not eligible. And if you put those requirements in, it's going to cost you more because of the requirements that are in there. So you don't want to do it if you're not intending on using those dollars. And so that's just we're going to continue to update you. They raised the concern when I met with the CIP team, and they're going to be monitoring the progress on these projects. That's the reason you see outside engineering firms with public works and with utilities, to where not only their team's working on getting these projects out, but they're bringing on additional horsepower to be able to deliver. Now, you have to encumber the funds.
So we have to have the funds, and the technical word is obligated, and that has not been defined either. I get Don nodding on everything I'm saying here because we're talking a lot about this. But obligated by December of 24, December 31st, 2024, and then it has to be spent by December 31st, 2026, with an exception of anything that was under that Flex Act that I was talking about. And that moved to September 30th of 2026. So with some flexibility came 3 months less time. And so we're working on, I promise you we're working through this. You don't need to hear all my troubles, but this is something that's top of mind.
I think that's it.
So is that it, Jim?
That's the end of the general fund and general government presentation.
Okay, well, before we break for lunch, I just want to, what?
I have one more thing, too.
You have one more thing?
Yes. Whenever you're ready.
Well, I don't know if I'm ready because I don't know what your thing is.
Well, we talked the other day about the Regional Planning Council and raising the sponsorship from $500 to $25,000, and you guys said you wanted to think about it. So at some point, either today or tomorrow, we just need some direction so we know what to do.
Well, how about we delay that till tomorrow?
Okay.
Because I have a question similarly to ask. At a recent meeting, we talked about the new dues for the mayor's council.
Yes.
My understanding is, because I was trying to figure out why, when they only meet 3 times a year and we all have to pay extra for the Christmas party, what do they need the money for? Well, apparently, and I understand, Commissioner Scott, you were there when they discussed it. You and Commissioner Justice, but he's not physically here at the moment, so do you remember?
I haven't, it's been a while since I've been to a mayor's council.
So my point being, do you have an idea of what you want to do? Because I've got this thing that keeps popping up on my reminder list.
I was advised that it was because the Florida League of Cities would not, they staff it. Linda Burgess is one of the persons. And, but they get paid through the Florida League of Cities. Yeah, that staff gets paid through the Florida League of Cities, and the Florida League of Cities would not waive or move on their $10,000 bill.
But the cities should be, you know, the way they used to do it, whoever was the head of the council that year, it was their city clerk that did the minutes and the meetings and all of that.
They changed that
A long time ago,
4 or 5 years ago.
Yeah.
They brought in the Suncoast League to manage it because it was too much for some of the small city clerks to manage it. And so they brought in, you know, the Suncoast League, and they've been managing it. But if the mayor's council hasn't adjusted their fees, just like they do on any other budget items, to account for that and the payments of that, then they either have to look at somebody else to help them manage it, they go back to the way they used to do it, or they raise the fees. So they're choosing to raise the fees. You know, I don't know that, because when we go to it, we still have to pay for the lunch.
Right.
And so I don't know the benefit that we get to being a member of the mayor's council.
I totally agree.
I mean, it's
And
a mayor's council.
And I did receive that information from Mayor Kim Welch, because I called after our meeting to say, why are you guys wanting this amount of money? So that's who I got it from as it relates to why the increase in the fees.
I'm a no.
I'm a no.
Yeah.
I mean, I loved it when I was a mayor. You were mayor at the time. It was great meetings, but you know.
I'm gonna say yes at this point, because I frankly have not done my homework with the people that I can talk to at the mayor's council, because it's absolutely crazy that it's morphed into this kind of issue. It was like a simpler time.
Yeah.
You know, when we had have the clerk from the city of Dunedin help me out during the year that I was chair, and just made it simple, and it's just about getting together and building relationships. And frankly, we haven't had very good ones historically. They have gotten much better over the last, number of years. And I'm happy about that. And I don't want to lose that. And I don't want to presume that it's just going to be there. I think we each have individual relationships that are really good. But
Well, we do, Commissioner. The point is, though, are the cities themselves raising their dues to cover it? I mean, I don't know any of that.
I don't either.
I don't think we should be bearing the bulk of the
Agreed.
Right.
difference.
And they switched to 3 meetings a year plus the Christmas party.
And they used to meet every month.
And we pay for the Christmas party, and we pay for the lunches if we go. So I don't know why their costs have gone up. So I know why their costs have gone up. Because they're
paying for that stuff,
outsourcing it,
yeah.
and the outsourcing is expensive.
That's true. And I think our lunch comes at, whatever fee we pay now, that's what our lunch amount comes out of. That's neither here nor there, but I do think a jump to $10,000, that's 3 times the amount, that's a bit much.
That's crazy.
That's a bit much, yeah.
Yeah.
I mean, I could see a modest increase, but that's a lot of money.
Well, we just heard the dire straits our own budget is in.
Absolutely.
I doubt the municipalities are going to come to our rescue to bail us out. So for that reason, I'm a no, and I have my own relationships with the different mayors and staff people.
What's the
so-
question that is yes or no?
Do you want to go from paying $400 a year to $10,000?
No.
Thank you. Hello.
Can I
I want to make sure I had the right question. So the question about do I want to give up on the mayor's council is, I don't want to do that.
Well, you
So-
can still go and
Yeah.
pay for your own lunch. That doesn't
Or
mean that.
can we pay a smaller amount?
Oh, I'm being corrected. It's 400 to 1,000 to 10,000. It is 10,000, right?
No, that's their total cost. The increase in dues is 400 to 1,000.
That 1 0 does
Well, that's a
make-
little different.
That's the that's a little gap.
If their
I could
total
probably
cost,
ish on that one, but
if their
expensive
total
day.
cost is 10,000, why are they making us pay for 1,000? There's 24 municipalities.
Well, that's
That's a
even,
whole nother ballgame. I mean, if there's 24 municipalities, we shouldn't be paying more than the rest.
Oh, because certain cities under 5,000 residents pay less, like some of the smaller communities. That's
Well, they need to work that out.
Yeah.
That's not our problem.
Yeah. Tell them we'll pay 400 or they can take it or leave it. 400 or nothing.
400 is what we pay now, what we pay now.
We're willing to continue to pay the 400.
is that your answer?
that's their allowance.
Okay, Tony, call them and let them know, please. Thank you. Done.
That feels a lot better than 1,000, yeah.
Well,
Yeah.
I did feel better that it was 1,000, not 10. I mean,
Yeah. And that's honest
Next
mistake.
week, our offer's going to be 200.
Well, we really, since they went from 11 meetings to, or 10 meetings, 3 meetings,
I just don't
they're
get
still
it.
getting a raise.
I just don't even get that. I mean, how it's going down in meetings and up
They're going down.
dramatically.
I mean, their food cost has gone down tremendously.
Everything's going down.
I mean, when they're going to 3
And,
meetings.
and they're having their meetings at the Tampa Bay Regional Planning, so they're not having to even pay
They're not having to pay for
the
that.
location.
For the location.
Yeah,
That's one of the big expenses.
yeah.
Yeah.
It's having
so-
the lunch at the
Yeah, they
hotel.
don't pay for lunch, they don't pay for the meeting spot.
And they're only meeting 3 times a year
Exactly.
instead
So-
of 10.
But we really enjoy our relationship with the mayors of the
In
county
case
of
they're
Pinellas.
listening or hearing.
In case anybody's listening, we love you.
We do, I'm sure.
I
So is
appreciate
there-
you. This is great. This is good direction. I have the
So-
$400 budgeted already, okay? So we're good
Is
there.
that still your motion, Commissioner?
We can't, yeah.
Oh, we're not voting, we're
Yeah.
just building consensus.
Yeah.
Thank you. I saw the look on your face, Don. What?
I'm a consensus builder.
Can we, to really complicate things, can I redirect some of my own personal budget to this?
What?
We each get an office budget, right? Can I
So if
use
you
a-
wanted to.
So
yeah.
can I can bump it, I can transfer $100, say, so we go to $500, yeah. Anyway, I'll talk to you later about that.
I guess you could, if you want to.
Okay. There you go.
Not
Take it
today,
right out of
Jose.
that office budget, Commissioner. That's a great idea. Let the record reflect. Let the record reflect. Commissioner Eggers has offered to pick up the cost.
He said $100.
Okay. Are we finished?
We're done.
Okay.
Lunch is
has
served.
been waiting for a while. For a while now.
Yeah, it wasn't